Hey, how are you? Good to see you. What's up, man?
Yeah.
We good, all right?
Yeah.
Y'all need anything? Water?
Good.
Coffee?
Good.
Good?
Yeah.
All right, here we go. You met these guys? These are our engagement. This is Bruce.
Hey, brother. How
How's
we
it going?
doing?
Good.
What's up, man? How are you? How are you?
Welcome in. We got the swag section.
What's up, Logan?
What up?
Gabby? How are you? So we have everything set up.
Here we go.
We'll be over here.
Nice. Look at this view.
Here we go.
Look at this.
Let's do it. What's up, everybody? My name is David. I'm your host of Highway to Health, and appreciate you being here. This podcast, it's really just a platform to celebrate the people, the organizations that are committed to improving access, experience, and outcomes for our patient population. There's a lot that goes into that. There's a lot of different parties that play their part. It's going to take everybody. And today we're going to talk about, the rising cost of healthcare, the rising cost of premiums, but also at the same time the decrease in the value that's being delivered to the employer and to the patient. We're going to talk about population health. We're going to talk about some of the biggest topics affecting our patient population today and how individuals and employers can start taking advantage of some of the innovative, entrepreneurial solutions that are in the market. That's why I'm really excited to have you on. Welcome to Highway to Health.
Thank you so much for having me. I'm excited to be here.
Yeah, well, you're welcome back anytime already. We had a cool introduction. You're a good sport. Thank you for being that way.
Of course. Thanks for having a hype man. Everybody could use a good hype man.
We're gonna get started, but it's a question I love learning from my guests. It's your healthy habits. What are you doing to make sure that you're at the top of your game mentally and physically so that you can perform for your family, for your organization, and for your community?
Mental health is really important to me. It's a journey. I'm in my early 40s and I've learned so much more about myself over the last 10 years and become more confident in who I am because of therapy. So I'm a big proponent of therapy. It should not be seen as a negative for anyone to say. Sometimes, we need that opportunity it's okay to ask for help. Yeah. It's okay to get another person's perspective, especially someone who's trained and has gone to school to help us navigate the traumas and challenges in life. So that's important to me. One thing that I've developed through my therapy and different practices that I've learned over the last few years is gratitudes. So every morning, one thing I always do is when I first get up, I have dogs. So the first thing we do is go out, and I don't take my cell phone with me. I do not look at my cell phone at least for the first 30 minutes after I wake up. I grab a glass of water before I get my coffee. And while we're going, through the bathroom routine with the dogs and getting the coffee made, I focus on my gratitudes. So what am I thankful for? What are the things in my life that I should be, telling the universe, God, however you look at that perspective, that I'm thankful for, and just simple as I'm thankful that I woke up this morning. I'm thankful for my health, right? I, in my late 20s, gained a lot of weight, and I was about 70 pounds heavier than I am right now. And it wasn't, a physical look thing that finally kicked in to let me know that was an issue. It was a doctor telling me that I had high cholesterol and I was like 31 years old. And it, thank God, was a turning point in my life. And so one of the things that I've struggled with my weight over the years is because of depression and anxiety and using food and drink as a way to, deal with certain things that were going on. And so I've really learned, tried different diet techniques. But when it really comes down to is, when you sit down to eat a meal, once you're full, I just don't eat anymore. And it sounds so simple. What helped me get the weight off was as simple as walking. Yeah. I do work out at the gym, but I don't love the gym type workout. I don't love being on a treadmill and not going anywhere. I really like sports. So, basketball is a big thing for me. Bike, cycling outside, or just walking. Back to the mental health side, walking is a huge benefit, especially if you take the AirPods off, you listen to the sounds, you ground yourself in nature as best you can, depending on where you live. And then there's also studies that show, as a couple, for instance, I'm newly married, got married earlier this year. Thank you. And as a couple, if you walk together, it mentally, with mirror neurons, helps you to connect together.
Really?
And to really create a more intimate and trusting relationship. So, exercise is so important to me. Yeah. Also, going back to my mental health, one of the things that my therapist always asks me is, what do you need to do to take care of yourself? Be thinking about that. One thing is, listen to your body. If you're just exhausted, your body's telling you need sleep. You need to disconnect. You got to get away. Yep. And then just, spending time journaling and really not avoiding the tough things that the mind brings up. And I am an overthinker. So, utilizing some of those tools. Meditation's been a huge change for me. A great opportunity. There's a guide to meditation series on Netflix that I highly recommend. Really? I think it's by Headspace. Yep. And it really taught me. I had so much trouble shutting my brain off, and it's been a huge change in my life since I started it.
It's something that we all need to build a routine around. The mornings are special to me too. I've got about a 55, 60-minute drive into the office. And when people hear that, they're like, golly, I don't know how you do it. And I tell them, I don't know how I do it without it, because, man, it's my time, and the sun's usually on the horizon, and it's just me and the road and my thoughts. And I get a chance to not only just prepare for the day and kind of mentally ready myself for, the things I've got to do, but it's hard, and I live out in the country, it's hard at that time not to look around and be grateful, for what we get to appreciate, get to experience and appreciate. And so gratitude's a big part of my routine as well. And if you're ever having trouble finding a sense of gratitude, getting out in nature is my hack, because look around. It's incredible. It's incredible what was created for us, and it's also incredible what we've created with what we've been given. I mean, we're right here in downtown Dallas. The wonders of the world are all around us, and that's always a good thing for me mentally. It's just to look around and appreciate what we have access to. And then anytime you can work out is and mornings are good for me on that too. So mental, physical. And the last thing I'll say about this is it's like being on a plane. What do they tell you? If you get into a situation on a plane, put your mask on first. Take care of yourself, yes, so that you can take care of the person next to you. But if you don't take care of yourself, you can't take care of anybody else. It's not selfish to spend time and focus on yourself, because that's how you help others.
Absolutely.
And so, first of all, I appreciate you sharing those things. And I think it's inspiring for others to hear. You're busy. I mean, you're a busy guy. You have a lot of responsibilities. But without taking care of yourself mentally and physically, you wouldn't be able to perform at a level. And I hope everybody starts to realize that. It's not selfish to take care of yourself. All right. So Carrington, awesome organization, right here in downtown Dallas. North Dallas,
Yeah.
I guess. But you guys are doing some incredible work, and we're going to talk about, challenging the status quo in this space of the industry. But something that sticks out in our preparation is this paradox, this dichotomy between rising premiums, rising costs, and decreasing value of our benefits. And for those that haven't had exposure to you and to Carrington and some of this information, what does that mean? How is that possible where costs are going up, value's going down?
Well, from an insurance perspective, and I'm not going to be one of those people that sits here and says insurance is bad and they're evil. You may heard some local commercials where they specifically call insurance the devil. We work with insurance companies. We help insurance companies create a more valuable product and better savings. But there are our real core and our focus are non-traditional benefits, sometimes called savings plans, sometimes called discount plans. They're basically non-insured. There's no risk. So the problem that we see with insurance today is that the premiums continue to rise with the rate of inflation, but the deductibles that we have to pay before that care kicks in and that coverage kicks in has increased. So we're having to pay more before we get coverage. And the maximums that are in place, you can only spend, they'll only cover so much, has stayed the same since the 80s. Take dental, for example, it's still a $1,500 annual maximum is what I see. Well, cleanings back in those days were $20, getting a root canal and a crown, maybe a couple of $100. Today, it's 5-6 times the cost it was then. And so you reach that $1,500 maximum
5
so
times
much
faster.
Exactly.
Yeah.
And so a patient gets into a situation where the prevention is so important in all of healthcare, not just dental, using that as an example. And so the policyholder as a patient is unable to get all of the prescribed treatment from their dentist under an insurance plan. So what we see happening is they will delay that important treatment that's been prescribed by their dentist until their maximums renew. And you see this in healthcare all the time too.
Yep.
You don't go get that scan done because you haven't reached your deductible yet. Or it's not covered unless you have a certain specialist that sends you there. So we have solutions that can sit outside of and complement insurance products to provide discounts to make these treatments affordable for the patient. In many cases, what we're starting to see with employers now, and we work with the broker community that's consulting those employers to provide the employee benefits, is they will utilize our products as a gap filler for the insurance, as an additional option. And then what's really cool about these products is sometimes it's really expensive to add your family onto an insurance policy. And so many of the employees will decide, all right, I'm going to cover myself with an insurance policy. But you can buy these non-traditional plans for 1/10 of the cost of an insurance plan and give that to your entire family. And we're very friendly with the allowing an entire household to use our products, because what I said earlier, these discount and savings plans are not insurance. So there's no risk. An insurance company wants to discourage you from using the coverage.
Yep.
They want to discourage you from having these high dollar treatments and claims. And so the discount plan is the complete opposite. There are no limits on use. There are no maximums that you have to worry about. You can get as many treatments performed as you want and always get a discount as long as you go to a participating provider. And that can be used, again, either before insurance kicks in with high deductible plans. It can be used once you've reached your maximum and you have no longer are able to use it. It can be used for those family members who aren't covered by insurance and they have these as savings, or things like I mentioned earlier with lab discounts and being able to go get scans. Prevention is so important. 100%. If you don't find it, and the longer you wait to find out what you're dealing with, the more critical and more expensive it's going to be. So insurance companies are starting to see also that these non-traditional benefits help them.
Yeah. And so it's a good partnership for everybody.
Absolutely.
I mean, it's obvious on the patient. You know, I've got a family of 6. Obvious for me on how it can help me save, and then also get me access to things that would be costly otherwise. I can see how it's good for the provider because they're avoiding these huge episodes of care probably more often because you're getting more consistent information and diagnosis and earlier diagnosis for the. But it's interesting. I didn't realize the benefit that the insurance company would realize through a partnership in these non-traditional benefits.
Absolutely. You know, we have one client that's based here locally, but they're one of the largest airlines in the United States, and they have a very good for the employee dental insurance plan in place. However, I was talking about maximums earlier, that they were continuing to get complaints from the employees that, hey, I'm reaching my maximum by summer. And then I have other treatment that I need to have performed, and I'm having to wait. And so that's when, in the dental world, for instance, a simple restoration of filling turns into a root canal and crown or an implant. You don't ever want to spend that kind of money.
Yeah.
Keep your own teeth is one thing that our owner, who's a dentist, would certainly tell you.
Yeah.
So they use this, as an employer group, this discount plan once they've reached the maximum, and for things that aren't covered by the insurance. How does the insurance company benefit from that? Well, those treatments that they were going to wait to do next year when when their maximum renewed, and they got their benefits back, were now they were taken care of under a discount plan. The insurance company doesn't have to pay anything for that treatment. The patient, because of how deep our discounts are in the industry, is still paying about the same as they would for that treatment under an insurance plan.
Gotcha.
Because things aren't covered at 100% when you get into that major or even restorative work, right? It may be covered 80%, 50%. And with our fee schedules, when we have 50, 60% discounts, and by the way, they're very transparent. The patient gets it before they walk in the door. They know what they're going to pay for each treatment. The dentist knows exactly what the fee is going to be. And so the insurance company avoids a lot of claim there, and they avoid that more major treatment that I was talking about. When you wait, preventative treatment is going to help the longevity of your oral health care, your overall health. And so it's a benefit to everyone, like you said.
Yeah, agreed. So you touched on, the transparency, right? And we've seen the No Surprises Act come through where, these providers are having to, tell you what you're going to owe before you opt for those services. That's hard on the provider for a lot of reasons. It goes back to the fee schedules. How are you able to deliver that transparency to the patient, to the provider? Because it's also very valuable for the provider to be able to, know what to expect in terms of reimbursement too. How does that work with a non-traditional benefit?
So I'm sure your audience is familiar with in-network providers.
Yeah.
That's part of all insurance plans. And what a lot of insurance companies have to do when they're building what we call the provider network, those practitioners that agree to be a part of the network, they're agreeing to set fees, which are a discount off their usual and customary fees. What they would normally charge any patient who came in the door without insurance, their full fee, or cash fees sometimes called. So in order to get enough providers to join that network, many times they do one-off adjustments and negotiations.
Sure.
And so it is not uncommon for an insurance plan to have hundreds of fee schedules across their network that these providers agree to. So it's virtually impossible to tell a patient before they go in as a policyholder what they're going to pay per treatment, because they have the ability to go to any of these in-network providers.
Okay.
What Carrington has done to make it easier, and because of what you said earlier with regard to these discounts and savings plans are a benefit to the provider because they don't have to deal with insurance. They don't have to be told by an insurance company what treatment should be performed. They're the expert.
Yep.
They're the doctor.
Yep.
They can decide with these discount plans exactly what needs to be performed. And so they're more willing to join a discount network many times than an insurance network for many of those reasons.
Yep.
And so what we've developed are only 12 fee schedules across the entire nation.
Okay.
And so we don't do the negotiation and confuse what the fee would be. So we tell the member whenever they join our plan, we send them a welcome kit that includes ID cards, and we include in that welcome kit the fee schedule for the zip code where they live.
Really?
And then if they're traveling and they need to go somewhere outside of their area, they can go to our website, search providers in their area, and then click and see the full fee schedule that they're going to pay at that specific provider. And so, our flagship plan, the 500 series on the dental side, it only has 7 fee schedules across the nation, and they're assigned per state. So you go anywhere in the state of Texas with that plan, which I do as an employee of Carrington. Sure. That fee schedule is not going to change.
So when you talk about transparency, like everybody says transparency, but what the heck does that mean? That's a really clear example of transparency. What transparency does for the patient, because healthcare is complex, and you confuse, you lose. You confuse in healthcare, you don't use in healthcare.
Right.
And when there's transparency and this understanding of what you're going to have to pay, what you're going to owe, it drives access because it drives utilization. It's not this scary ghost that lives in the closet anymore. I can anticipate what it's going to cost, and then I can budget accordingly, just like every other purchase that we make in our lives. That's been the biggest thing I've seen with the patient impact is, man, if I know what I can cost, I can plan for it. And so that transparency is huge. Tell me a little bit more about, how Carrington's discount savings plans, think about this in a larger scheme of things. Like population health's a buzzword right now. It's a big term. I can start to make the connections on how this would affect population health in a really important way, especially with chronic condition management.
Yes.
Talk a little bit about that.
So, it goes along the same lines as why the value of these plans can be greater or complement an insurance product. Because when you can afford the treatment and you don't have things like deductibles and maximums that are discouraging you from using the plan and getting the treatment performed that you need, that helps the overall outcomes of a group. So population health, really is looking at a group, and typically, we see that on the employer side, right? Most Americans receive their healthcare benefits through their employer.
Yep.
That being said, there is a big shift in the marketplace. The Affordable Care Act helped move many of the programs to this more voluntary basis. And the challenge with that on insurance is that you don't have a group to spread that risk of utilization across. Now you're dealing with insuring individuals. And if they've never had healthcare insurance, let's say, and then they go buy it, they're going to use the heck out of it, because they need it. And so that really is why insurers are nervous about individual programs, but the Affordable Care Act has forced them to look at those things. So these discount and savings plans that, again, can complement, they can fill the gaps of where insurance doesn't cover things, can be used after insurance's maximums have been reached. this ensures that the patient has a way to afford the care that they really, really need.
Yeah.
And so the outcomes will be better because, I keep saying it, prevention is key.
Yep.
And focusing on doing everything you can to prevent those chronic illnesses is extremely important. There are links, for instance, going back to oral health care, to diabetes, preterm weight babies, artery disease, cardiac disease.
By the way, I'm glad this is starting to get more and more mainstream. My dad was a dentist for 28 years, and he always talked about this. Growing up, I'm 38. So for the last 35 years, my dad's been telling me, like, when he looks inside a mouth, he has a pretty clear understanding of how healthy and what kind of lifestyle this person's living. And he said that forever. It's only been recently that you hear more about the importance of oral health when connected to overall health.
Yeah.
And I'm glad that's starting to get more discussion because, man, I've heard it all my life.
Absolutely. That's just one area. That's just one connection that I can talk about. And so, the nice thing about these savings plans, if you are pregnant, you can have as many cleanings performed as you want. And that's important to, the potential of having preterm weight babies born, and gives, the mom, some of that assurance that they're taking care of themselves and their baby. Some of the other things outside of oral care, we have programs that help with durable medical equipment and diabetic supplies. And so especially folks who maybe can't get out of their house as well, we have programs where they'll deliver them through the mail directly to their home.
What about virtual health?
Virtual health has become a real focal point for our company.
Okay.
Even before the pandemic, virtual care is something that oftentimes can be looked at and say, well, what can you really do virtually? I think most importantly is the quick access to advice.
Yeah.
And so we have many healthcare advocacy programs, including these virtual cares, whether it's medical second opinion, looking at your diagnoses, not having to go to another doctor, spend all the money and the time to do all the scans again, but utilize what you've already done with your primary physician and then getting a specialist to look at it for you. But because Carrington realized how important virtual healthcare was, we actually created our own company a little over a decade ago called Dial Care. Okay. And so one of our sister companies to Carrington is Dial Care, and we have your primary care with urgent care where you can talk to an MD when you have something going on. Avoid going to a waiting room. We're going to share illnesses with other patients potentially. Avoid having to wait for an hour before you can get in to see the doctor.
Exactly.
Avoid a $40, $50, $80 copay that you have to pay them. Yep. And instead either get on the phone or a video call with a physician. And if they can determine what your diagnosis is, then electronically prescribe treatments to your pharmacy of choice. And I can tell you just the ease of use of something like that is massive. I travel a lot for work, and being able to do that anywhere in the United States is really important.
Yeah, it's paid off with kids too, where you talked about avoidance earlier of these big health episodes. For us, it's helped us avoid emergency room visits that are costly. For everybody involved, it's expensive, right? But in that moment, I'll pay for it later. I've got a sick kid or a hurt kid, and I just need them to be seen right now. Virtual care, telehealth has been a huge tool that we've leveraged in our family to avoid those costs, but still get the information you need, especially when it's such a sensitive and, in the moment seems like an urgent deal.
Right.
So, this whole conversation has been about challenging the status quo, whether it's non-traditional benefits, virtual or telehealth, understanding that, look, when people need healthcare, they should be able to access healthcare and not worry about, the hidden costs that come with it. Carrington and companies like Carrington are continually challenging the status quo and bringing access, outcomes, experience, improvement to all those areas of our lives. If our listeners could understand one thing, Carrington's such a great company, this industry, this challenge is so big, but if you could narrow it down, what's the one thing you want our listeners walking away understanding and be able to, share with their friends, their family, their coworkers?
We live in one of the most progressive and financially stable countries. We have access to water. We have all of the basics covered. And yet our healthcare system seems broken many times. It's also extremely confusing.
Yeah.
And so, what I would say to people is kind of most important is to focus on your health. Make it more important than anything else. You said something earlier that really struck a nerve with me, which is take care of yourself first. That's the only way that you can help your friends and family and those that you support. And, you made the analogy just like on the plane when they say the air, the oxygen mask drop, put yours on first before you help others. It's so important that we don't, it's easy for us to tell other people, this is important. You need to go do this, go see the doctor. It's easy for me to tell my family members when they're being stubborn. For whatever reason, as humans, it seems to be difficult for us to remind ourselves. And so I would just remind everyone to say, if your body's telling you something, or if you're feeling a certain way, that's your body telling you what you need. Are you extremely tired? Are you feeling run down? You need rest. You need to disconnect. Are you sneezing and struggling with allergies? What's your environment? Are you sitting indoors all day long? Get out, get some fresh air.
Yeah.
So just focusing on yourself first is the number one priority. And then it gives us the opportunity to help those that we love around us.
Yeah. Well said. And, for me, as I have these conversations, I learn a lot, right? That's one of the biggest side benefits of having this podcast, having these conversations. I've been in healthcare the last 13 years. I learned something new about the innovations, the non-traditional things that are coming to market that are available, that's improving, access to care, experience, and outcomes. I would encourage everybody to be curious too, and look into some of these things that you may be less familiar with. If you're an employer, you have that obligation, responsibility to do this, to look into these things, to learn for your employees. If you're an employee, if you're an individual, same responsibility for yourself and your family, the ones you care most about. The way you handle other areas of your life, other areas of your business, with that entrepreneurial spirit, that curiosity, we should be treating healthcare and our own personal health with that same type of curiosity, because
Absolutely.
there are resources, there are solutions, there are partners out there that can bridge these gaps that traditionally we didn't have answers for.
Right.
And so I appreciate you coming on and sharing some of that information for me and for our listeners and for everybody else.
Yeah, that curiosity for our own health is so important. And, it's also important at all levels, but it starts at home.
Yeah.
And then it starts in our community, those that we impact and we're around. That education, talking about mental health, and that's another virtual care service that when the pandemic hit was just so imperative. And now that whole industry is completely changed, because now you can get on a video call or a phone call with your therapist, and they could be, pretty much anywhere in the world, depending on the law. And, you really have access to mental health in a way that we never had prior to the pandemic. But I would say being curious, focusing on the home and your local community, so important. And then, if you're inclined to be more of an activist, make sure that our government leaders know how important healthcare is. There are so many topics as we're here in an election year, and next week early voting starts here in Texas. Make sure they know healthcare it should be number one. Again, like I said earlier, our country has an embarrassment of riches. The fact that we don't take care of our family members, our citizens, as well as other countries who don't have those embarrassment of riches, is really a sad thing, and it should be a focus on all levels of the government.
I agree, and there's a whole series of misaligned incentives that have led us down this path. And there's a whole lot of money and a whole lot of influence going against the overall improvement of the individual's health. And we've got to get that more aligned.
Yeah.
And you're right. Every 4 years, it's the biggest topic because it impacts everybody. And who knows where we go from here. But I think we have an opportunity individually and from the grassroots approach to really change the leverage point and the influence of power, because we control more than we know we control.
Yeah. And I like when you said, if you're an employee, tell your employer how important these things are. Tell them about things like non-traditional benefits, because in our country, many times this is the way we've always done it. And so we're educating at Carrington the brokers. And so if you're an employee, tell your employer about non-traditional benefits. If you're an HR manager at a company, tell your benefits employee benefits consultant, there are these other benefits. Why are we not using these to help with population health? And so on and so forth. If you're an employee benefits consultant, please get educated on these. Learn what's available and be teaching, your clients how we can make a change. If we don't make a change, then we can't fix it.
Right. I mean, we collaborate on every other decision in our business and in our lives. Right. For a long time, we've just accepted whatever benefits package, whatever carrier, we were given. It's time to have these conversations because there's options available.
Absolutely.
Thank you.
Thank you for having me. Love to talk all day about healthcare.
We could. You're welcome back anytime.
Sounds great, man.
Thanks.
Thank you.